Hey guys, Simone here. Welcome back to my channel. In this video, I'm going to be comparing equity and equality. If you're not sure how the terms are different, I'm going to really break that down for you. If you're interested in implementing concepts to achieve equity in your organization or through a system, I'm definitely going to provide some best practices for that. And I'm also going to look at this specifically through the healthcare lens and talk about social determinants of health. So stay tuned for the video. So first and foremost, I'm going to start with social determinants of health. We really need to understand what those are if you're going to understand health disparities or why concepts related to diversity and inclusion and achieving equity matter in the first place. Because we need to have this comprehensive understanding of what impacts our health, right? We're not just looking at, we see some disparities for certain communities. We really need to unpack why that is. So social determinants of health are these factors that when put together and combined, they impact your physical health, right? Your health outcome. And when I say health in this context, in this particular video, I'm talking about physical and mental health, right? So you can kind of assume I'm talking about the whole body, the mind and the body. But these factors, when you put them together, these elements and aspects of our lives, when you combine them, they all influence our health outcomes. And so it's really important that we understand that it's not just age related. It's not just race and ethnicity. It's not just diet. It's a combination of all of these factors. And then of course, it's all through this cultural lens as well. But when we think about social determinants, just by their name, social determinants. So there's these aspects of our kind of position, if you will, our status in society, our social status is kind of what we're thinking about when we talk about social determinants of health. Where our status is with regards to certain components is going to influence what happens to us when we enter into certain systems. So of course, income is one of those. Another, of course, is race and ethnicity. There is no context where race and ethnicity don't matter. Right? There's no context, especially in a country like the US, that is really so wrapped around this concept of racial identity and whose history is so intrinsically connected to it. There's no way to have an appropriate conversation about any policy or program if you're not looking at it through a racial justice lens. So of course, that is a huge social determinant because we know that historically people of color, Black, Indigenous, and people of color have long had health disparities that white people don't have, or to the same degree. So we know that that's still a factor and it still has a significant influence as well. And then part of that, we have to talk about of course, racism, right? It's not just what's my racial identity, it's racism, and then racism within the context of the health system. The Affordable Care Act, much of the conversation centered around access. And while that's great, that's a huge component of it, you have to ask yourself, what are we getting access to? So for all of these individuals who are now stepping into the health system under healthcare plans that they've never had before maybe, or going in to get preventative services that they weren't getting before because they were going to the ER for preventable care or for their primary care. So now that we're going to the doctor more often, which is ideally what would happen, right? What's happening there? So what are you getting access to? And is it really beneficial if now I have access to a system that's racist? Is it really beneficial that I have access to a system that's classist? We continue to have this overrepresentation of a perspective of a gender binary. So typically people are referencing male versus female, right? Man versus woman. This is a gender binary. Individuals exist beyond the scope of those two categories, those two boxes, right? So when we think about gender identity as a social determinant of health, we really now are expanding that out to understand that if you don't align with this, traditional norm that's been created around the gender binary, then you really are at higher risk. And you probably are not receiving care or services that are equitable and that are culturally appropriate for you. And then another social determinant of health is location. Location, neighborhood, zip code. So location being like geographically, do you live in an urban center or a rural community? Being more isolated from certain health services. And there really being a shortage of health professionals in rural areas, specifically in the field of dentistry. And then of course there's transportation. If you live in a food desert, ask yourself, how far do you live away from a grocery store? If you typically only have access to like a corner store, right? What does that look like if I have to go get my groceries from a little corner store or bodega versus actually having access to a grocery store that I can afford? If that is a challenge for you, then you may live in a food desert. Also, of course, when we think about location, we have to consider things like environmental racism, right? We have to consider in the context of climate change overall, but the fact that there are these toxic plants in other locations that are placed intentionally in poor and specifically communities of color. And the impact that obviously is going to have on their overall healthcare. If you have toxic fumes that are coming into your community directly, there's been a lot of research and a lot of conversation around that, but I feel like not enough. There's not enough of a conversation around environmental racism, especially again in the context of overall climate change activism. Zip codes that represent neighborhoods that are right next to each other can have sometimes 20-year differences in the life expectancy. For years and years in the diversity and inclusion field, the term that was used was equality. Equality really centers on this concept of fairness. And fairness in this context is completely through a white racial identity lens. This idea that everyone should just be given the same of everything because that's fair, and that you should just pull yourself up by your bootstraps. This is really a privileged perspective to take if there ever was one, right? Because it does not ever take into account the systemic, the larger systems of oppression that so many people are up against. It's really easy to talk about pulling yourself up by your bootstraps when you're not sitting underneath the weight of these oppressive systems. From a systemic or a government perspective, with this idea of fairness, this would be saying that we're just going to provide every community with the same access to something, right? And for example, we're going to provide community A with 10 apples and community B with 10 apples. What that doesn't take into account is the fact that community A owns all the apple orchards in the country, right? They have endless supply of apples. Not only that, they sell apples to community B, right? They sell apples to everyone else, but we are still going to provide them with their 10 apples. And then community B, they get their 10 apples and they're just going to have to plant some trees and make it work, make it shake. Do what you got to do. How is that fair? How is that actually fair? It isn't. And that's the whole point of equity, right? Versus equality. So equality is like, I'm going to give you all the same thing because I'm thinking that that's fair. But the true fairness, the real fairness, is if I give you what you need to get to the same place that they're already at, right? If we talk about this proverbial level playing field, we hear that phrase all the time. So if you're going to level the playing field, first of all, that assumes that there are people that are here and people that are here. So in order to level the playing field, is that level? In order to level the playing field, there are some resources, some assistance that this community will need, that this community already has clearly, right? And so equity is about meeting you where you are. Meeting a community where they are. What are your needs right now? And how can those be met? But in order, again, to do that, you have to address things like social determinants of health. You have to address all these factors of someone's life. You can't just say, I'll give you some money because it seems like you don't have any. When it's like, when it's really attached to so many other things. But it seems like all of a sudden, sometimes people just want to forget that and oversimplify everything and just say, oh, figure it out. Everybody else figures it out. A lot of people have a lot of help that they don't acknowledge. A lot of people have been given head starts in life that they don't acknowledge. Many times because they're not aware of it. And then also many times because they know that if they did acknowledge it, that it would somehow reduce the work that they did put in. Because healthcare in the US is a system within a white supremacist society, it perpetuates racism. Full stop. It's not a debate. It is factual information. For so long, scientific evidence, medical proof was used to justify and kind of prop up this racist idea that Black people or enslaved Africans at that time were physically and mentally inferior, were less than human, truly less than human. And the medical community perpetuated that, propped that up. The medical community provided this data and research to that effect, conducted experiments on enslaved Africans. And the experiments continue long after slavery, but that's another video. But I mean, so the history is so pervasive in terms of these racist ideas really being funneled through the medical community. And then also a sheer lack of willingness to really put forth the appropriate amount of attention to conducting research and drawing in data around the health of communities of color, around the impact of certain things, including COVID-19 in communities of color, is just so slow moving. And we certainly know why that is. A lot of that is wrapped up in the fact that if I start releasing data, if I start conducting research and bringing out all this information, and then I have it in front of me and I'm looking at it, and everything seems to be cordoned off by racial lines, right? It's like, oh my goodness, who is faring the worst here? Wow, people of color. Who doesn't have as much access? Oh, people of color. Who doesn't have, right? Just going down this list and realizing that the communities consistently that have the greatest need all seem to have one thing in common, and that's not being white, right? So time and again, the data shows you, and even across socioeconomic status considerations, it's not just the money, it's not just the access, it is literally race. And so if it's the patient is not doing anything, if these are just patients coming in for services, but their outcomes continue to be different, you have to look at that in the larger context. It's not just because this person is Black or this person is Latinx. There's more to unpack there. I was an executive director of a nonprofit that really pushed, specifically in the healthcare and the mental health care field, really advocated for a lot of public policy changes, and really pushed forward kind of concepts and research and information around cultural competence. And one of our pretty significant pieces that we, for a long time, were trying to really push through was this legislation to require health professionals to be trained in cultural competence. Right? Seems harmless enough. Seems like that should be happening already. The biggest pushback in the medical community was from the top, right? Surgeons and MDs that felt like after all their years of education and training, they didn't need to be told how to deal with people from diverse backgrounds, even though it gets wider and wider and more male, took offense to the fact that they were going to be told how to handle their patients or engage with their patients. I treat everyone the same. I don't see color. I'm a doctor. I talk to everyone the same way. And it's just fundamentally not true. None of us treat everyone the same. We're human beings. None of us do that. It sounds great to say it, and I understand why people say it. It sounds really good. I'm a nice person. I treat everyone the same. But that comment, first of all, is a microaggression. And the reason it's a microaggression is because it has the opposite effect than what you intend. What you're basically telling that person is, not only do I recognize that you have a different racial identity than me, but I don't want to talk about it. It makes me uncomfortable. Let's move on. I don't see color. I don't know what you're talking about. I don't see color. I don't know what's happening. I don't know where I am right now. What are you talking about? I don't see color. What are you talking about? A color? Who? What? That's the energy that kind of comment gives off. Why are Black women who are multimillionaires so much more likely to lose their lives in terms of maternal health, but then also their babies in terms of infant mortality than white women who are in poverty? What is the consideration there? Have access to what you would think would be the best medical care in the world. The medical schools that are still teaching about who registers pain and how. Or once you start your residency within a hospital, senior nursing staff telling you, oh, those people, they're always complaining about their pain. You don't listen to them. They just do that all the time. And this racist idea that Black people literally don't feel pain as much, that our pain tolerance is physically higher than other human beings. Our pain tolerance, like when we bleed red blood, it just doesn't hurt us the way it hurts other people. Do you know how incredibly racist that is? And this is something that is believed consciously and subconsciously within the medical community, and people are dying as a result. Babies die as a result. So when you talk about the equity, when you talk about providing access, that's not the full conversation. It's always about the quality. It's always about these other factors that people don't consider enough. Part of what frustrates me so much about that is that we hear about that. There'll be a news article about a Black woman who almost lost her life because she was suffering from a blood clot or some other medical emergency. And she told the attending physician, they just didn't believe her. They told her she was being dramatic. And it turns out that she was having this medical emergency. But the way that the stories are told and written, it's almost like a feel-good story. Like, oh, she stood up for herself and she fought for her rights and you should do the same. And she saved her own life. That's also preposterous to me. I'm in the care of these other individuals. They're responsible, right? For my care, for listening to my symptoms, for paying attention to me from an equitable perspective. The opiate crisis that we are still very much in the thick of. There was this overprescribing of this medication to white patients, which led to white patients becoming dependent on opioids. It's not that Black and brown patients didn't come in with injuries during this particular time period. That's not the case. Certainly did. Came in with the same injuries, but were not prescribed the same medication or were not prescribed it to the level. So what does that tell me? Once again, probably connected to things like feeling like, well, you said your leg hurts, but does it really hurt? Probably not. But the white patient after you, if they say their leg hurts, it probably does. I believe them more than I believe you. Because of the demographic that has been affected, which is white and then also affluent, the response has been totally different. Right? Ever since the war on drugs, and even before that, there was always this focus on poor communities, communities of color, as being these drug users. Now, all of a sudden, there are these drug courts that are providing people with access to treatment instead of incarceration, which is phenomenal, right? I think we can all agree that that is great. That is amazing. Considering the amount of people who are in jails and penitentiaries for low-level drug offenses, right? My problem with that is, of course, that the people that are still in jails and penitentiaries for these drug offenses are predominantly people of color, and the individuals who get access to these treatment programs are predominantly white. Senator Steve Huffman of Ohio. And if you want to know why health disparities exist or why people of color are being impacted by COVID-19 differently, you might ask the question like he did. Is it because colored people just don't wash their hands as much or wear masks? His words on record. But we're not going to talk about racism, right? We're not going to talk about that. That's too much. Oh, no. We couldn't possibly. And then, wait, it gets better. Because then you might be, if you were to ask a question like Senator Huffman, you might just be rewarded by being added as the chair of the health committee. Ta-da! Can't make this stuff up, folks. Couldn't make it up if I wanted to. Can't make it up. Or even in the case where the system says, okay, well, maybe we'll try to, implement certain policies or programs to meet a specific community's needs. We saw this with the vaccine, right? We are going to put the vaccine in poor communities and communities of color first in order to provide quicker access to the vaccine for these communities that are clearly more at risk. And what happens? Affluent, suburban, white people drive into these communities and get vaccinated. On the news, the individuals administering the vaccines and working at these locations are on the news saying, yeah, we know that these individuals don't live in this community. We know that. And so what? It doesn't matter. So what was the whole point of the program? If you could just show up from wherever, what was the whole point of the program if people were allowed to come in and take what you set aside for a certain demographic away in order to achieve that equity, just without any accountability because of their privilege? So we find ourselves again back to this question: if there's this system that was innately designed to harm me, how is it supposed to help me? And furthermore, how am I actually supposed to just blindly trust this system to help me? Countless cities across the country have declared racism as a public health emergency over the past year and a half, which is awesome, which is great. If you're not sure why that's happening or what that's related to, it's necessary to declare things an emergency, a public emergency, in order to open up some certain funding streams, which can be really helpful to get programs and move services and get services to communities that need them quicker than you would without doing that. And so that's the idea around that. But again, as somebody who has come from the political space, as a former speechwriter, I can't tell you how many eye rolls it elicits from me when I hear this phrase. This is a great first step, right? We're passing this measure to declare racism as a public health emergency, and it's a great first step. Because my problem with that is that coming from that space and understanding it is that typically you're not going to see another step, right? Step number 2 or B for years oftentimes. And what's happening in the meantime with government decision-making and bureaucracy and red tape, all of that going on. Meanwhile, communities still don't have access, still don't have the services that they need. If you live in a city that has declared racism as a public health emergency, make sure you're contacting your representatives and checking in with them to see, what's going on with this. Was there a committee that was created for it or a task force? How often are we going to get updates about changes that are happening with regard to this particular policy? Just make sure you pay attention to that. Because unfortunately, in the political space, they really bank on you not paying attention. I mean, really, really they do. But that's another video. That's a whole nother video entirely. If you are in the healthcare field, if you're a health administrator and you are looking for training for your staff, make sure you visit crawleycultural.com and request a training. I've been working with health professionals for years. I have a deep admiration for individuals that work in that space and really appreciate all that you do. But yeah, if you're looking for training, make sure you go to our website and hit the subscribe button to make sure you stay tuned for all the next videos. See you later.